I have a trainer, I do my supplements, I would get lipo done, I would get my sculpting done to get that overall look for my body. A lot of guys will hide it because they are afraid that people think that it's cheating, that they could just do it in the gym. Hey guys, my name is Dr. Jason Emer. I'm a cosmetic dermatologist in Beverly Hills, and I started getting into the industry years ago when I actually broke my nose, and then they repaired it, and I thought, okay, I want to do something plastic surgery related or cosmetic surgery related because it really changed my self-esteem. When I was in medical school, I started doing a lot of cancer therapies and realized that skin was something for me. When I went into dermatology, no one was doing cosmetics, very few people were. And I started treating skin cancers and people were left with scars. And those scars I really wanted to improve. And at the time, lasers were just becoming popular. We had peels, we had some injectables, but we didn't have all these things that you see now on Instagram and online. And so we started lasering, we started peeling, we started doing combination therapies to get these scars to improve. And it was dramatic, the improvement that the scars had, but also the self-esteem that my patients had. So I went directly into doing cosmetics. One of the biggest things that I do in my practice, no pun intended, is penis enlargement. And it happens to be a very trending topic right now because years ago women were all about getting their bigger boobs and taking care of their vaginas for sexual health, and men were kind of left behind. And so many men were coming into me asking what could they do to make themselves feel better about themselves, have stronger and harder erections, better orgasms, and better sex life. And we started thinking, what can we do for the penis? So not only did we start doing injections that increased the blood circulation and gave men better sexual satisfaction like PRP injections and stem cells, but we also started doing enlargement to the area. We use fat injections like taking your own fat from your stomach and back and injecting it into the penis to get it increased in girth, but also filler injections like hyaluronic acid fillers that are dissolved if you don't like them. They're sugar-based, so they're natural to your body, and they're injections that are done on the penis to make it a little bit longer and a little bit larger. Now we have some more permanent options using an FDA-approved PMMA filler called Bellafill, which is used for acne scars, but we also use it off-label for penis enlargement. With reversible fillers in the penis, it goes away over time, so nothing will change. If you leave it after a year or two, all the filler will be gone. However, if you do permanent fillers into the area, it tends to grow over time, so it's really important that you do multiple sessions to get the exact size that you want, so it's not irregular and it's really even. If you leave it over time, the dissolvable fillers into the penis, areas may dissolve more rapidly than others, so you might have irregularity, lumps and bumps as it's dissolving. So it's really important that if you're going to maintain it numerous times throughout the years. So in general, most people will do 1 or 2 treatments a month or 2 apart, and then they'll do it once or twice a year as a touch-up. So a big part of my practice, 50% is liposculpting, the other 50% is fillers, lasers, and Botox. And when I first started here in Beverly Hills, very few people were treating men. Actually, my client base was 50 to 60% men because I was a young man doing a lot of male cosmetic treatments. So I've always been seeing a lot of male treatments, and it's on the uprise because of COVID and people looking at themselves on Zoom, really wanting to get a more chiseled, sculpted look and not wanting to see the double chin when they're looking down on their cell phones or in the computer screens on Zoom. And so what we're seeing now is men coming in wanting not just line filling, but actually sculpting. They're wanting their chin, their jawline's really built out. They want that sort of model, hollow look. They're wanting those chiseled features like enlarged cheekbones. And we're even doing balancing of the face, talking to men about the upper third of their face, working in their temple region, their eyebrow, keeping everything open, which is not something they normally would do. It's not something a patient would actually notice or that you would see when you walk out, but it just makes your face look harmonious and looks better. So men are coming in now. They get really worried when you say to do so many syringes in so many areas. So we go conservatively. We always start with a small amount in each area first, give it a couple weeks to settle, and then build on that. And once you get to that building point where you're happy, where you have that chin more wide, you have the jawline more sculpted at the 90-degree angle, you have the cheekbones popping out a little bit or the under eyes improved, the temples filled, We then let that set for about 6 months. Usually men, especially those that work out a lot, can metabolize fillers more quickly. So at about 6 months, they tend to need a little touch-up because you'll notice it going down. It still will be about a year before the filler's gone completely, but if we do a 6 months touch-up, we can really keep you looking your best all the time once we've maintained that sculpted look. So what I'm finding is men are wanting to get these treatments. It doesn't matter sexual orientation, it doesn't matter their race, they're all wanting the same thing, a more masculine, sculpted look, and we're doing that with fillers. So it's going to be more likely to develop that scar tissue, so exercising and really working out makes a big difference.
Hey guys, it's Nisha the PA over here at Dr. Emer's office, and today I want to show you how amazing my patient looks just one day post-op.
So one of the things I'm known for is what we call our gladiator transformation. In the female side, we call it the supermodel, but in the male, we call it the gladiator. And years ago when I started doing liposuction, just so you guys know, dermatologists were the first to create liposuction. Actually, I'm a board-certified dermatologist, and dermatologists in the 80s discovered tumescent anesthesia, where you could actually numb an area awake and remove fat without any pain. We progressed into doing now this gladiator transformation, which is really sculpting out the abs, defining the chest and the arms, and using any fat that's removed to build out the musculature. It could be the rounding of the shoulders, it could be increasing the calves, it can making the buttock bigger, what we call BBL, or what I call as the soccer butt lift, and making the entire body look like a Titan or Gladiator or that 300 movie. So what we do in those cases, especially for the guys that are more fit, you're going to get a better result because we're sculpting around the muscle, the skin's already tighter, you're already athletic. That's what this type of surgery is for. If you're overweight, you have loose skin, you're in a transformational period where you're trying to lose weight, it might take you a little more time to get that gladiator look, but we can give you the canvas to get to that look after surgery. What are the aftercare required for gladiator? That is massage therapy, IV therapy, and hydration because you're under anesthesia for a lot more time. We're removing much more fat. It's more aggressive of a procedure, but also hyperbaric oxygen therapy where you go into a chamber that increases your oxygen levels to help you heal more quickly. That's done for 7 to 14 days. If you follow all of that, we can really get this complete transformation, and then you can take it to the next level at the gym. We're even doing now internal wellness using supplementation, oral supplements like vitamins, but also hormone therapies, peptide therapies to really boost the ultimate result. So if you're athletic, you're a great candidate. If you're in the transformational period where you're trying to lose weight and you have some loose skin, we can get you to that point. But you really need to understand the gladiator procedure is a much more sculpting procedure, not a traditional liposuction procedure. It requires a little more downtime, but can give you such an ultimate result. I have a trainer, I do my supplements, I would get lipo done, I would get my sculpting done to get that overall look for my body. Removing a little bit of fat is nothing. You can do that awake in tumescent anesthesia, you can do that at any traditional cosmetic surgeon or plastic surgeon's office, but getting that sculpting is a much more detailed artistic work, and I think you should be more proud of it. But a lot of guys will hide it because they are afraid that people think that it's cheating, that they can just do it in the gym.